Well, welcome everybody to October's. God, I can't believe it's October. So if a community group for October, um, I'm standing in here because Christina is out busy spreading the word with mental health professionals at a conference, which is really cool. I think she's making some cool contacts there. So the subject of today's community group is anxiety to thriving, and we've invited Lisa to come along and share with us her amazing program that she's developed for getting people away from anxiety and into thriving. This is kind of a bit of a two-part. So for those of you who are here for your own health reasons or family health reasons, then today you're going to get some awesome information from Lisa about how to remove anxiety from yours or your loved ones' lives. For those of you who are here running your own practices in whatever field, this is a bit of a two-part, really. This is kind of part one of how to put together a program which targets a very specific problem. And that's precisely what Lisa's done here. So part two of how to put this together, so all the behind the scenes bits about how Lisa got to where she got to, we're actually going to share in the practice growth group for October, which is Monday week, so Monday the 21st. So if you wanted to come in and jump in and have a look at the behind the scenes bit, then please do jump into the practice growth group, register for that, and we'll talk about the behind the scenes bit. But firstly, before that, so without further ado, let me introduce you to Lisa Hill. Lisa and I have worked together now for a number of months. Can't remember when we started, actually, our journey, Lisa. I'll let Lisa's going to explain to you kind of how she's had a transition, really, from how she was practicing and what she was doing, why she came to want to transition, and then actually how she's done that transition, and then tell you about and talk you through and show you the Anxiety to Thriving program that she offers. So without any further delay, Lisa, over to you.
Thank you. Thank you so much, Mark. And welcome, everyone. And I'm very honored to be here. And Mark, we've been working with each other for a little bit over a year now.
Wow. Okay.
Flown by. Yes.
Exciting times.
Yes.
Yay.
So
wow.
Thanks.
Cool.
So I'm going to tell a little bit of my story first, because my story's always got to get in there because it's part of my practice. It's part of who I've become because of where I was. So I'm Lisa Hill. I practice, my practice, Hill Family Wellness, is in Texas, and I'm now online. I see clients online and in person. I hold a bachelor's in biology and a minor in psychology, so I've been always fascinated about the body and the mind. I have my master's of science in nursing. I'm a certified recovery nutrition coach, level 1, and soon to be in about a month, level 2. So I've gone through the 18-month-ish program with Christina and the Academy and absolutely loved it. Have learned so much, so thankful for the Academy. I am an IASIS certified provider. So I'm a provider of a microcurrent neurofeedback system called IASIS. And I'm also a MindLift approved functional neurofeedback coach. And I practice as a functional wellness coach, again, online and in person. I think of all of that also to say that I am a real person. I've been where a lot of people have been. I've been on this journey through my years and have come out on this other side to thrive. And so I'm really happy to be here today and explain my story. I've been in the health and wellness field for over 30 years. and just absolutely loved it. Loved working with people. About 20 years ago is where I really started to dive into the rest of my life. About 20 years ago, I had hives, and the medical community said, tested me for all these allergies, and I was not allergic to one thing. I was given antihistamines, which helped, was not told one thing about nutrition. So at that time too, I had some anxiety, but just went about my fast-paced life. A few years after that, so 15-ish years now, the hives came back with a vengeance. And I missed work. I was on antihistamines. I was offered steroids. But nobody ever said anything about diet. So I continued to do my own little search, and I ended up at that time in functional medicine. And the functional medicine part of it, functional wellness medicine part, ended up looking at my diet, ended up encouraging me to make some changes, ended up giving me suggesting some quality supplements. So that took away my hives. It started taking away my anxiousness. So I was on to this. What is this? So fast forward a couple more years, or about 10 more years, I was exposed to mold, and so ended up detoxing from getting a detox program from mold through functional medicine. And during that part of my journey is when I found this amazing device, the IASYS microcurrent neurofeedback device. So what this device does, it is just a microcurrent of energy that interrupts the abnormal brain waves that you have, and lets those healthy brain waves go back. And it is fascinating. So I was using this for mold. I was using this to really continue to get out of my mold. But what I found is after about 3 visits with this device, I had my mind got so much clearer, and my focus issues got so much better. And what's cool is that my focus issues, I had a hard time focusing pretty much my whole life. So it's just part of who I was. I didn't know that all of you people could focus better than I did, because it's just who I was. But my focus got better after a few sessions with this device, and I gave myself permission to be the client, to the recipient, until about the 17th visit. I was encouraged to receive 20 visits, received 17 visits of this microcurrent neurofeedback device, started feeling so much better, coupled that with diet, coupled that with eating better, keeping my blood sugar regulated, and then started asking the questions of the provider. What is this? How do I get this? So dove into the IASYS microcurrent neurofeedback device, ended up purchasing it. My husband and I purchased it. We founded the company Hill Family Wellness. And then now is my true journey. So then I started, hung a shingle. I was told, anyone with a brain can benefit. So happily, I had a few friends who received treatments from me. So they told a few friends. So I had clients from amongst friends, but never could get the marketing part of it. Never could get out there. Anyone with the brain can do this. So why is anyone with the brain not coming to me? But again, found great results for those clients. And then I had some clients that would walk in with the Red Bull in their hand, or McDonald's, or some fast food. And I was like, okay, this microcurrent is amazing, but it's not going to be totally effective when they're, doing fast food and drinking energy drinks. So I've got to do something about this. So I ended up another God thing, God put in my path, another client who needed some extra help. And then in my building was a counselor, a provider who could provide the extra help with the amino acids. So that is how I found Christina in the academy. So I dove into the, now 18-month program with Christina in the academy, and have learned about amino acids, how I can supply, give amino acids. Easy one is a real simple one that I'm going to tell you about is for anxiety. One of the choices, if someone's having anxiety, is L-theanine. So I can provide the client with L-theanine in my office, and within, 10 minutes or so, the client is just calmer. So really, and then couple that with, of course, with diet that I've learned in the academy, keeping your blood sugar stable, eating protein. So coupling all that together, I was finding just really, really good benefits. But still, I had the challenge of finding people. And I really didn't know where I wanted to land it, because I was still all over the board. Because I can help anyone. I can help brain injury. I can help anxiety. I can help depression. I can help calmness. I mean, not calmness. I can bring you to calmness, can help focus, can help sleep. So that's when I found Mark at the academy. And he has been my coach for a little bit over a year. And he has helped me put together this Anxious to Thriving program, because what I ended up doing is I ended up polling all the clients I had for that amount of time, and really found out that my top 2 categories that I was attracting were people that needed help with anxiety and needed help with focus. So we wrapped it in. I'm going to share my screen now. Let me see. Okay, I'm just going to share this here. I worked with Mark, and ended up coming up with my, let's see, can you see, are you able to see, does it say From Anxious to Thriving?
Yeah, that's Anxious to Thriving. Yep.
Wonderful. Okay, so ended up, Mark worked with me, and to get more details on that, you will, come to that Monday program that he mentioned, and you can hear more behind the scenes of how I came up with this. But I found that I was able to get people out of their anxiousness into thriving, and actually get them to focus focus better through my program. So let's take just a listen to my my video, and this really sums my program up. This sums up what I can do. So let's go ahead and take a listen.
Do you have an
Whoops, 1 second.
Anxious mind or a lack of focus? You're not alone. Join me for just 3 visits over 10 to 14 days and experience profound change. Let's get you to a better place so you can handle life's challenges as they come. Let's take a recent client of mine, for example. A mom, age 36, 3 children under 10, her anxious mind score being a 9 out of 10. She was going from one task to another, reacting extremely, yelling at her kids, not finishing tasks, falling into bed at night, completely exhausted. After 3 visits, just over 12 days, Mom reported her anxious mind score was now a 2 out of 10, and she was much calmer and much settled and not yelling at her kids anymore. In just 3 or fewer visits, over 10 to 14 days, you too can experience profound change. I've designed this program to deliver fast results because I'm fed up with seeing people suffer that really don't need to be suffering. People like this mom who have been struggling for years, even decades, and not seeing any change. She's tried prescription medications, talk therapy, other alternative therapies, and nothing seemed to work. Together, we'll embark on this simple 5-step journey to quiet your mind and sharpen your focus. Change is inevitable, but it all has to start with taking the first step, DSD. Do something different. Your journey to focus and freedom starts here, but the question is, are you ready to DSD? Are you ready to do something different to experience profound change, just like this mom? Are you ready to thrive? Click the link around this video to sign up for your free download. You'll get the download of immediate actions to start calming your mind and boosting your focus. Then let's have a chat to see if we're fit to work together.
Okay, so that's that was my video, and that really sums it up. And what I've really found, and again, Mark really helped me with this, is you've got to want to do something different. So what I will do in my program, I meet you exactly where you are. I see where you have been. What have you done? How long have you been there? I ask you, what are you, where do you want to go? What, if we could change one thing that's going on with you in the next, 10, 12, 14 days, what would it be? So I have you, tell me about that. I work with you with, let me see. I work with you with 5 simple steps. First, I'm going to calm that brain down. I'm going to calm you down. Then we're going to start looking at some causes. Then we'll start repairing. Then you thrive. Then we get you to optimal thriving. So, we're going to take each one of those a little bit at a time. So here is just a little visual of the first step, calm and hope. Usually takes, 1 to 2 weeks, but you are going to become calmer and you are going to receive hope. And that's what I find for most people, or many people, they're stuck in this for a really long time. If I can offer them, and I can offer them and you a little bit of hope that it will change, then you start trusting me, you start trusting what's going on, you start trusting yourself that you will change. We identify some causes then, that's usually on, weeks 2 to 3. And then we just start diving in and repairing and get you feeling better. What I've really found too through this journey, I'm not just going to work with you and let you go right away, because you have many people have been without not in a calm state, with some anxiousness. Many people have been not the best focus for a long time. As I shared with you, when I received some better focus, that was very, very new for me. I had to go through those feelings of what is going on, what I can focus on this. My heart's not racing. I mean, it was really weird. So I was really happy to have someone walk through that with me to get to my new state of normal, because now that's my normal. Let's see. Let me see. Here are some other on my Anxious to Thriving page. This was the mom I talked about in the video. I've also another little story. I've had a 19-year-old female who with focus issues, spacing out during the day. During her 3-session, 12-day journey, she was able to go from a 9 out of a 10 with some of her focus scores, with 10 being the worst, to a 1 out of 10. I mean, in just a few sessions and just 9 days. Here's one more, 55-year-old diabetic female, anxiety, chronic tiredness. She related herself to a 10 out of 10 for anxiousness, 10 out of 10 for chronic tiredness. And just in 3 sessions over 10 days, was able to go to the anxiousness was reduced to a 3 out of 10. And then the tiredness, she was getting better sleep, was down to a 2 out of a 10. So, I mean, it really works. It's simple. I'm all about simple. that's where I am. And, make sure if you have not yet to look at my download. But I also wanted to show you, let's see if I'm going to click on another tab. Let's see. Did everyone see that I changed screens?
Yep, my approach.
Great.
Perfect.
Wonderful, wonderful. So what I've found is, so this is on my main website that just got a relaunch, and I have Rochelle who did it so beautifully, and I'll tell more about that on that Monday. But what I use is again, I meet you where you are. I want to see where you are and what you want changed. And we document that. Then for the IASSIST neurofeedback, if you hover over this, you will see a little bit more about IASSIST. It calms the body down from fight and flight. There are also neurofeedback's just amazing how it can do that. But then on my website too, you can click on some links. There are actual studies that supports this therapy. So I encourage you to do that when you're on my website. And right now I'm going to skip over to nutrition, amino acid therapy, and quality supplements. So of course I've spoken a little bit before that I'm almost a level 2 certified now with the Academy, and really like that, and have loved the Academy. And so I've learned about nutrition and coupling it with amino acids to give you right there in my office. I have samples, will get you calmer while you're in my office. Big thing too, we talk about protein and keeping your blood sugar steady. So that's another area. Also quality supplements. Sometimes people need some extra supplementation. So I'll figure that out for you and have some recommendations. The next thing, what I've added into my program also. So even if I have people, you as my client, I have you and you're doing better on neurofeedback, you're doing better with the aminos, but there's just something there still. And say maybe a really good one to suggest is to dive deeper into is pyroluria. So the cryptopyrroles, what's happening, your urine, you're excreting too much B6 or zinc and zinc. So you have no chance to build the calming neurotransmitters. So I'm also will do functional labs, suggest some functional labs to do. And we dive a little deeper, and I've found that on some people. So then, they are on some aminos, they're receiving neurofeedback, they're doing better, but there's something there, just a little bit more. Find they have too many cryptopyrroles in their urine. So pyroluria, a pyroluria condition. So then we add B6 and zinc, and they feel even better. So I can also dive into other functional labs. We can do some other testing when you continue your journey with me. And then of course, mindfulness, some somatic calming practices. I encourage, I have some little breathing techniques I will do with people, with my clients. I encourage you to get outside. I encourage you to, if it's safe, to put your bare feet on the ground. I'm all about that. So I think everything works together. I think all of this works together to produce this synergistic approach. So this a 1 + 1 + 1 + 1 + 1 equals 20. So we're just going to get a better combination whenever I incorporate everything. So through my journey, also I really like this online space. I love working with people online. I've loved all the people I've met through the Academy, and that they live in different countries and areas across, the US. So I've also found a device. It's called MindLift. It's a traditional neurofeedback device that I can offer to people, and you can do this at your home. So you can do it on the go. And it's pretty neat. So I also have some information here about the Mind Lift, but it's again traditional neurofeedback. I will do an EEG through this app that you have at home. I can deploy an assessment to you, which is it utilizes a sequential quantitative EEG, and it will target areas in your brain that need some assistance. So therefore, then a Mind Lift, I send you training programs on your app that you do at home that will help those areas in your brain become more optimal. So again, couple them with diet, amino acids, higher protein, labs if needed, mindfulness, calmness. And so that's where I've come up with my program. And really, I'm going to, let's see, switch back here. One more look at this. Go slower so we don't get dizzy. It's a really simple approach that I've come up with, calming you down, figuring some things out, repairing, getting to your new thriving, live with you there, because you're still going to be seeing me for a little bit because I want to make sure you're okay with where you are, and then up to optimal thriving. So we just continue to work. So I'm really excited to be practicing as a coach, and just really excited that I can encourage you and be with you every step of the way. So that's the program I've come up with, and welcome you to click some links, click around my newly launched website, hillfamilywellness.com, and have a call with me. So sign up for a free 20-minute call. So that's it.
Nice, thanks, Lisa. That's awesome. And we're going to open up to questions in a minute, because Community Forum is all about having discussions and learning from each other. Just in terms of, so that's the 10-week program.
Yes.
That you offer, don't you? But you kind of potentially, you have been doing it in 2 chunks, haven't you? Did you just want to tell people a bit about that?
Sure. Thank you. So what I currently do is I bring you in with 3 visits and get you, that's the common hope, to have you start, trusting me, trusting yourself. This will change. It's really about trusting yourself and giving yourself hope, giving you hope, and you really believing you can change. And then we go ahead and go on for a 10-week program to see, to continue the changes, to dive deeper into the causes. So so that's what I do. And then after those 10 weeks, we see where you are and see what, maybe you're good. Maybe you want to stick right here for now. We've gotten you some really good success, because we will have some success. Or do you want to continue? Is there something else that came up? Sometimes when we start digging, other things come up. So you're like, yes, now I want to work on this a little bit more. So we will start working on that. So thanks. Yeah. Thank you for that.
Yeah, that's awesome. And in terms of what you charge for those, what would people invest into those 2 chunks, or the whole journey for you?
Yes. So, well, I'm finding that I want to individualize this for you. So if you give me a call, we have a chat. Let me see exactly what you need. Let me make sure I'm a good fit for you. And then we'll go from there. So
yeah, like it. That's cool. Thank you so much. I love love to get be good for you to hear. I know the website's working for you, because you're regularly getting clients as well. But
yes.
It'd be interesting to hear, Elena, Libby, what you've got to any questions you've got, or feedback you've got as well, because questions and feedback are both good.
Yes.
And maybe just before you jump in, as we didn't kind of at the beginning of the meeting, we didn't kind of actually do a bit of a round the room introduction. So maybe just before you ask your question, if you just tell us who you are, where you're at, and kind of what you do, because this is about being able to share community, swap details, network together as well. So you're very welcome to pop details in the chat. And welcome, Libby. Glad you could join us.
Hi,
Sorry you didn't get the link first time round.
Sorry, I'm so late.
No worries. No,
welcome.
That's cool. Good
Thank
to have you
you.
with us. Yeah, Elena, sorry, you were going to ask something.
I was going to ask a
jump in.
question, but if
Yeah.
you want to introduction.
No, just before you ask your question, just tell us a bit, tell us who you are, where you're at, and kind of what you do.
Right.
For Libby's benefit.
So I'm in Sacramento County, California. I know Lisa and Mark very, very well at this point. A graduate of Christina's level 1, and actually kind of auditing that level 2 for some months now. And I'm a certified nutrition educator since 2006, Bowman College, certified recovery nutrition coach 2 years ago. I think so.
Must be.
And also my main focus is, as a practitioner, is people in recovery from alcohol and drug addiction, and am a card-carrying, long-time clean and sober member of the universe myself personally. So that is my main focus. Yeah, that's it.
Nice, thank you. That's cool. And
Take
your
it away,
question
Libby.
well, that's right. What was your question? Whilst you, what was your question?
Well, let's. I want to know who Libby is.
Yeah, cool. All right. Yeah, jump in, Libby. Tell us who you are.
Hi guys, lovely to meet you. Thank you. Thank you for that presentation, Lisa. That was really, really interesting. And I just about got in time, so I managed to catch up really quickly. So yeah. So yes, I live in England, just outside London in the country. I was a nurse for 40 years and then became a bit disheartened with westernized medicine and branched out and became more of a holistic nurse. Trained as a yoga instructor, Reiki master, sound therapist, all sorts of things. I managed to, very, very fortunate to open a healing sanctuary with my husband about 3 months ago, offering healing and mainly sound healing, shamanic healing, Reiki. But found that a lot of people, well, most people actually that come to us are coming with a certain level of anxiety. Sometimes understanding where it's coming from, sometimes not understanding. And over the last sort of 6 months, I've wanted to pull my nursing qualification and everything that I've got kind of together. And then I stumbled across Mark and started to hear about the amino acids and just became absolutely fascinated with it. My son is hopefully a recovering addict. He's on his journey, having a few slips, but he's on his journey. He's been doing really well. He had a cardiac arrest last October, so he's very, very lucky to be alive. So I'm hoping that that's kind of been the catalyst for him to want to move forward. So I've got that interest as well, that I really want to be able to help him as well as help other people. And I only just started last week with the course, so I'm trying to get my head around all the different names of the amino acids. But we do have a neurofeedback place over in Farnborough. Is that the same thing, Mark?
So it's a different system, but neurofeedback. So again, they do the QEEG brain mapping as well.
Yeah.
And they do the neurofeedback, and I mean, I use that regularly for my clients. It helps with anxiety, sleep, addiction, trauma, really, most people find really, really powerful stuff. Yeah. Yeah.
Yeah,
Absolutely.
so I'm only about 45 minutes away from those guys, so I might go over there and
Yeah.
have a chat with them, see
Mm.
what they're up to. So yeah, I'm at the very beginning of my journey. But yeah, really interested and fascinated, and thank you so much, Lisa, for explaining what you do. And I would be really interested in setting up some sort of program around anxiety, because I think it's just so badly needed, and particularly with everything that's going on in the world. We live in a fear-inducing world. So
Yeah.
yeah, I really want to be able to get to a place where I can help people with that.
Nice. Yeah. Well,
Thank you, Lizzie.
that's awesome. That's really cool.
Yeah.
So Elena, you had a question, which I hope you haven't forgotten.
Yeah, it was funny, just as I was thinking like, oh, how do you do this IASIS remotely? And then you pulled up the Mind Lift. So if you're working with someone only online, you direct them to this remote neurofeedback thing.
Yes.
How
Thank
you
you.
do it.
Yes, thank you for your
And
question.
do they like, how does that work? Do they get it like a machine in the mail? Like,
Yeah, you do. You do.
interesting.
Very interesting. Another, you know, thing that God put in my path, because I
Yeah.
love this neurofeedback. I mean, I'm a believer. I mean, I trust it. Now I've been using it for, going on almost 4 years. So it is a headband that you wear. You wear this headband and it senses, you move an electrode around, you plug in a little electrode to the headband, and you get your app on your phone and it senses your brain waves.
An app on your phone. Interesting.
Yes, it's an app on your phone. They've now developed it to as easy as an app on your phone. So I deploy the app to you. I arrange for you to get the headband. I arrange for you to have the app. And then if this is easy, well, no.
So in other words, the person like needs to go through a practitioner such as yourself to do this
Yes.
remotely.
Yes.
I'm just curious. I'm just
Yep.
trying to paint the picture.
Yes.
Do you find